Good evening. My name is Mason McCurdy, and the health issue that I've chosen to speak about is diabetes. Diabetes, in definition, is a disease in which the body is unable to properly use and store glucose, or glucose is also known as a form of sugar. What this does to the body is it causes glucose to back up in the bloodstream, and that causes the blood glucose, or often referred to as blood sugar, to rise too high. There are two major types of diabetes. Type 1, formerly called juvenile onset or insulin dependent diabetes, the body completely stops producing insulin, a hormone that enables the body to use glucose found in foods for energy. People with type 1 diabetes must take daily insulin injections to survive. This form of diabetes usually develops in children or young adults, but can occur at any age. The next type is type 2, formerly called adult onset or non-insulin dependent diabetes, and this is the most common one. Diabetes results when the body doesn't produce enough insulin and or the unable to use insulin properly. Insulin resistance. This form of diabetes usually occurs in people who are over 40, overweight, and have a family history of diabetes. Although today it is increasingly occurring in younger people, particularly adolescents. Diabetes can occur in anyone. However, people who have close relatives with diabetes are somewhat more likely to develop it. Other risk factors include obesity, high cholesterol, high blood pressure, and physical inactivity. The risk of developing diabetes also increases as people grow older. People who are over 40 and overweight are more likely to develop diabetes, although the incidence of type 2 diabetes in adolescence is growing. Given what we have learned in this class, this means that rural areas have a higher diabetes rate than the urban areas, due to many suffering from the food, dessert, and obesity running rampant. This health issue is sometimes hereditary, but the majority of it's targeted due to poor behavioral habits, meaning their behavior is not consistent with a good diet, good physical activity, and lack of caring. However, I say lack of caring loosely because I do not want to offend anyone. Many that suffer from diabetes knew they were putting themselves at a higher risk, but chose to either not care or believe it won't happen to me. By taking environmental factors into consideration, it piggybacks on what I briefly spoke about before. Rural areas are a hot target for diabetes due to many being in a food desert, which in a nutshell means lack of grocery stores that provide good food options and are highly dense in fast food chains and convenience stores that offer many unhealthy options. However, this doesn't just apply to those rural communities because diabetes is everywhere and anyone can get it. Talking about diabetes from an economical, political, and ethical standpoint, it has influence in all, but some more than others. Economically, the disease diabetes is a huge moneymaker for the country, due to many people being patients. But that thinking is also not ethical. In other words, it is a cash cow for healthcare facilities and insurances. Politically, I'm not sure how diabetes really plays a role in politics other than the politicians themselves that suffer from it. Ethically is tough as well. Like I stated before, it is unethical to think of diabetes as being a great cash flow and revenue, but it happens every day. It also plays an ethical role in the mindset of many providers, meaning some are tired of dealing with the patients and the disease and are quick to make rash decisions because of it, such as a patient visiting a healthcare provider, and rather than that provider treating them, they just opt to amputate and be done with it. Not only is it unethical, but is also malpractice. Lastly, but certainly not least, is the future of diabetes. Unfortunately, that future, as of now, appears to be as dim, if not more, than it is today. There are many institutions, individuals, and groups trying to combat this unruly trend by providing free diabetes education, and they are doing so by the way of classes, seminars, and brochures. However, Until the public itself wants to help, it will be a tough job. Like stated before, some people cannot help getting diabetes thanks to their hereditary ties, but those people are the few. We, as healthcare providers, simply need to keep educating, stay active with the people that want us to, and push the ones that don't. Buddy that with modern medicine that is getting better and better every day, and we still may have a fighting chance. Anyway, this is my final video. Thank you for your time, and I hope you and yours have a Merry Christmas and a very Happy New Year. Thanks so much.